In today's video, we are going to talk about the updated information about the PG in Germany. I have already made the video on how to do PG in Germany. At that time, I tried to find the information from the people here, get to know some information from somewhere, and based on that, I have made one video regarding it. The last month when I came to know and met some dentists who were already doing PG in Germany. From that, I found some different information that how did they do PG, which way they have done it. There were some irregularities in the both of the knowledge. I decided to contact the dental council personally and I visited them, find some real information that what is actually PG in Germany, how you can do it, how many years, what are the procedures to be done. Hello everyone, this is Dr. Swapnil Chandratre here. Basically PG in Germany for dentists, two types of PG. Okay, one is the free PG and one is the paid PG. Let's talk about first the free PG. The information which I gave which remains the same. The PG in Germany is only in two clinical branches mostly. One is this orthodontics, second is a oral surgeon. In some state now they have started PG in periodontology also. There is one non-clinical branch which is a public health. Those are the only branches for the free PG. Basic requirement for doing any PG in Germany, free or paid, is the approbation. What is approbation? This is your permanent license after clearing your KP which you receive it. Any PG, if you want to start, first you need to clear your KP exams. After that only any PG can be started and can be valid. That thing you need to know, that you cannot directly do PG or you cannot get directly any admission. You first need to clear your KP exam and then it will go further. In terms of clinical branches, the most common in every state is orthodontics and oral surgery. There is also one branch which is Mund-Kiefer-Gesicht Chirurgy, oral and maxillofacial surgery. On that we will talk later. First, let's talk about these two main dental branches. As I said, the first requirement is your KP exam. Once you clear your KP exam, you need to do a 1 year of general dentist side. You need to work in any general dentist clinic for 1 year. If you have that 1 year time, after that you can start applying for the PG. Where you can apply? For applying, you need to contact dental council of your state. Then they will give you the list of the clinics where this PG can be done. Now this PG is divided again into the three parts. First is this general dentistry part for first year. Then you will require 2 years of the clinical side, that specialized branch. 1 year is your academic side that you need to do in any of the university hospital of that state. Let's go through with it. Okay, so again, as I have told you, 1 year first you do the general dentistry. Okay, and after that you contact your dental council. They will give you the list of the clinics. You need to apply to that clinic with your documents. If they select you, then your PG is started there for this during 2 years of time. Once you are done with your clinical time, this 1 year you need to do in the hospital or the university clinic. In university clinic, you need to do this, your thesis, your presentations and seminar, and some cases which are not performed in private practice. Those are all things you will learn in the university clinic. Clinical years where you practice in the private clinic, there you will learn how to run the practice, about how to do day-to-day work, what are the patients you do, and all those things. You do everything practically. It is not always that you do 2 years combined in first and then do 1 year combined. Sometimes it is like there's a combination that you do 6 months here in the clinic, then again 3 months in university, or something like that. That structure will be decided by the clinic university. It is a combined study, so it is not like that you will be working only in the same clinic. Combined duration, I would say, is a 4 years. If you have already worked 1 year in a private practice after your KP, you directly start with your PG. Previously, I told you that PG is 5 years in Germany, but it is not like that. PG is actually 3 years, okay? But if you count 1 year of a general practice, then it's a 4 years. It remains the same for the orthodontics and the oral surgery. Both it will be the same, but very important that this 1 year is counted only after your KP. If you have worked before your KP, then that year is not counted. That is a very important thing. In terms of earning during this time, you will not earn in the percentages during that time. Generally, the earning is in the range of 4,000 to 4,500 euros per month during your entire PG duration. Once you are done with your PG, you will be called as a Fachzahnarzt. Dentist is called as a Zahnarzt in Germany. The specialized dentists are called as a Fachzahnarzt. That is the degree you will receive. So it is not like any MDS, okay, but it is called as a Fachzahnarzt. Another clinical branch is oral and maxillofacial surgery. Now for that, the basic requirement for it is a permanent license in dentistry, permanent license in medicine. This both thing you need to have a combine to apply for it. You already have studied dentistry in your country. You need to first clear your KP exam. So with that, you get this permanent license or approbation in dentistry. You need to do then your MBBS. Yes, MBBS is again 5 years. It's like a bachelor. When you do this bachelor of MBBS here from Germany, you clear that MBBS exam. After that, you get your approbation or the permanent license for medicine. Now, once you have these two things, then you apply for the oral and maxillofacial surgery. In that, you do PG in that particular department. That way, you can do this oral and maxillofacial surgery. Theoretically, if you think like that, after clearing the KP for the dentistry, you need to give 5 years of this MBBS, and over that is Mundkiefer Gesäßchirurgie, so that is oral and maxillofacial surgery, another 5 years. 10 years you will require after clearing your dental KP exam. It is a little bit longer way. If you are very much passionate about it, then you can pursue it. In terms of this non-clinical branch, public health, it is mostly a university based structure. Okay, it is a non-clinical branch. It will be more about data recording, all this kind of stuff. I don't have too much of information about it. If I found it, or if people are excited about it, or if they want to do it, then they can contact me. We'll see and try to find more information about it. Mainly our focus is on the clinical branch because that is real money where it lies. This is all about the free PG in Germany. This paid PG, it's like with the fee structure. Generally the fee for this PG is around 35,000 to 40,000 euros. The duration is around 1.5 year to 2 year time. After this paid PG, you will not be called as a Fachzahnarzt, not a specialized dentist, but you will be called as an MSc dentist. MSc is a degree which you get it, Master of Science. On that MSc, you have a multiple branches, whatever the branch you do. For example, implantology or periodontology, endodontology, aesthetics, laser. So many branches are there. You can choose any of it and that you can do. This PG is not a full-time, part-time. One side you can keep on working in the clinic. This PG will be done, for example, twice in a 1 month or once in a 1 month. For example, if you have a 2 years of this entire duration, let's say you have 20 lectures or something like that, 20 weekends or Friday, Saturday, Sunday, you will get this entire your plan during this 2 years plan, how it will be done. Weekend thing, and your job is also there, and parallelly you are doing your PG. Again, this PG also remains not in the one place. For example, you have 10 modules, then you might have to travel 5 different cities. Okay, one is in Munich, one is in Berlin, second is in Düsseldorf. So it will be like a moving thing. Based on the module, you need to go in that particular area to learn that thing. In that also, you will do your thesis and all that. In the end, you will be also called as a doctor. The degree will be like an MSc in whatever the branch you have done. This is the big difference between free PG and the paid PG. In free PG, you are not paying anything, but you are getting the stipend of this 4,000 to 4,500 euros. Compared to the paid PG, it's like you are working in one side, so whatever you are earning in the clinic, that is going on. One side, your PG is going on for your this MSc degree. This is the way it works. This is the updated knowledge regarding the PG. If I am missing something, or if you know something more about it, please write down in the comment section. Our viewers can know about it. And if I find more information, I'll always make a video.